sponsored by the Carpal RX. If you're thinking of having surgery for your carpal tunnel syndrome, you're probably also considering the risks associated with that surgery. Those risks include reaction to the anesthesia, excessive bleeding, nerve damage, failure of the surgery, permanent weakness in your hand, infection, delayed healing, loss of job time, scarring of the surgical site, and even death. Many people are completely unaware that there are alternatives to surgery, and these alternatives, rest, splinting, and massage, are recommended by the American Association of Orthopedic Surgeons and the National Institutes of Health because they're 91% effective in treating carpal tunnel syndrome. The first of these alternatives is rest, and it means just that. It means to stop doing what made your hand hurt in the first place. Avoid the activities that hurt your hand, and by all means don't try splinting your hand and then going back to the activities that hurt it in the first place. The other alternative is splinting, and this is just another way to have your hands at rest most of the time. Splinting should be done minimally during the day, but should always be done at night while you sleep to keep your hand from bending and twisting unconsciously. Finally, deeply massaging the wrist and forearm on a regular basis is nearly 100% effective in alleviating carpal tunnel syndrome. But to be effective, it has to be done properly, and it has to be done daily for 2 to 4 weeks. So when you sit down with your doctor, make sure you discuss these alternatives, and especially discuss the fact that most people are dissatisfied with their carpal tunnel surgeries, but the vast majority of those using non-surgical therapies are quite satisfied. Your doctor should candidly and openly inform you of this because those statistics are so important that the Association of Orthopedic Surgeons and the National Institutes of Health recommend that all patients try all non-surgical options before considering surgery. Remember, those non-surgical options are rest, night splinting, and deep tissue massage. Deep tissue massage is nearly 100% effective when applied daily and for a period of 2 to 4 weeks. Applying the deep tissue massage for anything less than 2 to 4 weeks or anything less than daily is worthless. And to get professional and effective deep tissue massage therapy for your carpal tunnel syndrome, you don't have to visit a therapist every day. Instead, the Carpal RX will give you the same therapy at home. If you have carpal tunnel syndrome, you owe it to yourself to try this remarkable product and take advantage of the 60-day free trial offer with every Carpal RX. If the Carpal RX doesn't relieve your symptoms, or if you just don't like it for any reason, return it for a full refund, including all of your shipping costs. The Carpal RX was specifically designed to treat the wrist and forearm. It works just like a therapist's fingers that are treating you for carpal tunnel syndrome, except it treats you every day and at a fraction of the cost of a therapist. The Carpal RX automatically produces the same motions that a therapist uses to relieve pain and other symptoms, and it's so simple to use. Just plug it in, slide it on, and strap it in. Then relax. The Carpal RX will do the rest. The Carpal RX always has a 60-day free trial, so if you're not completely satisfied with your results, return it for a 100% refund, including all your shipping costs. The Carpal RX is guaranteed to permanently and easily get rid of carpal tunnel syndrome, as well as wrist tendonitis and repetitive strain injury. Visit the Carpal RX at carpalrx.com.